Thanks for joining us today, Natalie. I feel privileged to have got to know you recently and understand your work. I'd like to hand over to you to introduce yourself and the work that you're doing and what we're going to talk about today.
Thanks, Kris, and thank you for the invitation. It's really great to be able to connect with you and to talk about the CRE we have, the Centre for Research Excellence in Paediatric Palliative Care. A little bit about me and where I've come from. I've got a background in nursing, goes back many decades now, and I worked for most of my career in children's cancer and paediatric palliative care. When our palliative care service started up in 2009 here in Queensland, that was the first time we looked at applying some of the work we had been doing in the cancer space, but broadening that out to all children and families who could benefit from paediatric palliative care. It was really quite eye-opening to me, just how much need there was out there in the community, children with all sorts of different conditions. And so since that time, had a really strong interest in the space. Worked very closely with different clinicians and researchers. Here we are, 15 years later, now with the Centre for Research Excellence, where we hope to continue developing the evidence.
But tell me, what is the Centre of Research Excellence and why are they supported? What does the government hope to get from supporting these kinds of initiatives?
Yeah, so a really good question. It's funded through the National Medical Health and Research Council by our Australian government, and it's an investment in the research community, recognising that there could be some benefits in bringing a group of people together. It's not funding an individual project or a team. It's really about bringing together as many researchers, community members and clinicians as we can to work collaboratively to address the issues in the sector. Our centre is based out of QUT, Queensland University of Technology, where I'm based. It's a virtual centre in terms of we've got partners in New South Wales, Victoria, and South Australia, and are wanting to reach across the country and bring people together in a virtual sense to get the centre up and running and get our programs out.
So it's very much a national project and bring that expertise into one spot, I guess, virtually, as you said. I know the CRE was an outcome of the Paediatric Palliative Care Action Plan. I was involved in that from a personal perspective because my son has a life-threatening genetic epilepsy syndrome. It's into a lot of our families, plus other families who have similar genetic conditions, dealing with acute issues with their children, having catastrophic seizures, and the potential of needing palliative care is quite high. I was involved in the action plan to get that lens into it because our families don't often get palliative care as easily as some other conditions. It's been a passion of mine to try and improve that. What came out of the action plan that led to the CRE?
We were involved, before the action plan was initiated, we were involved in doing a literature review to inform elements that were brought into the action plan back then. And as you said, the beautiful thing about the action plan is that it really does bring the voice of lived experience and consumers and community partners in there. That is really refreshing. I think often we see different plans or strategies come out and they don't always have that lens. So from a researcher's perspective, that was really nice to see that come through. And then what was great about the action plan is it does really set out 4 priority areas, and one of which includes data and research. Even through those 4 areas, there was really clear areas where research could contribute to advancing the cause. We really looked at that National Action Plan and looked at where were the areas that we could contribute from a research perspective, where we were missing evidence or where we could advance knowledge by undertaking research and addressing those priority areas. So we put that together and put that out to the NHMRC, and they agreed that it made sense to fund our CRE because it really spoke to the plan that had already been set out and agreed upon.
For us lay people and families, how does this research that you're doing will commence soon translate to families? What's your hope there?
A big part of our CRE is that knowledge translation. We recognise that sometimes research that's undertaken doesn't always immediately result in changes to service. So there's a lot of work now focusing on that implementation and how we get that knowledge translation. We're dedicating a big proportion of our CRE to that knowledge translation aspect of it. So once we have the evidence, we need to have a really clear pathway of how we get that evidence into practice, how we change services or how we advocate to policy and government for different resourcing and mapping out pathways to do that at all different levels, at the community level, at the service level, at the policy and government level. We'll be working strongly with Palliative Care Australia and with our other community partners to try to get the messages out there loud and clearly and move evidence into practice so that families can realise benefits earlier.
And just to touch on working with families and other stakeholders, you've been building a really strong consumer engagement framework for the CRE. Do you want to just touch on how that is such a positive thing for outcomes?
Yes, I think to have any lasting impact, we want our research that changes practice to have meaning for children and families. That impact is really important. Also honouring the National Action Plan that had such a strong consumer voice. We wanted to make sure that we had consumers well represented throughout our CRE, both at an advisory board level. That's where we asked you, Kris, to come on and give us some advice about what that should look like. At the individual project level, we've got 9 projects mapped out, and that's likely to grow. Each individual project needs to look at how it partners with consumers and community members. We need that pipeline of new researchers coming through. There's an opportunity for us to work with consumers to mentor our newer researchers, our young PhD students, and how they can also partner with consumers. So there's lots of different levels where we can involve consumers in the research process, right from identifying what the problems are, helping us come up with appropriate designs and ways of interacting with families, reviewing different documents. All of those aspects of consumer involvement will be really important to us.
I want to take a step back now and just go over what is palliative care. In my experience, I often hear that my child's not at the end of life. And that's where a lot of people go when they think of palliative care, but it's much more than that. Just wondering if you could give us an understanding so people can see where they can actually benefit from palliative care.
And you're right, there is a real misconception that palliative care means end-of-life care. And while that is a component of palliative care, it is certainly not the focus of it. The word palliative actually comes from the Latin verb palliare, which means to cloak. And so that's really about protection and shield. So in a way, it's talking about the symptoms that children and families experience when they are going through a really difficult time being faced with a life-threatening illness. Palliative care aims to address any symptoms that children or families may be feeling in an effort to improve quality of life. So that may be physical symptoms, but also certainly some of the psychosocial symptoms, even socially feeling disconnected or spiritual issues. The aim of palliative care is to work with individual children and families to identify their needs and where they may be experiencing distress, and then to work with families to address those and alleviate unnecessary suffering. So it's certainly not about end-of-life care. In the National Action Plan, one of the parents said palliative care is about living, not about dying. And it does have that real focus on what a child and family is going through at that point in time, not focusing on end-of-life care. What does a family and child need right now?
I was going to ask you about, particularly in paediatrics, it really does need to be family-centred because the impacts of having a sick child does impact the whole family unit, and how having that support actually makes quite in their well-being.
I think we all recognise when you've worked in paediatrics as a healthcare professional, supporting the caregiver so that they can provide the care to their child. It's not that the health professional directly necessarily provides that care to the child. We need to support the caregiver so that they can look after their own child, and they've got the skills, the resources, the equipment, all of the different things that they may need to be able to do that.
What does a palliative care team look like?
The team is made up of different types of healthcare professionals, certainly medical and nursing staff. But I think it's the allied health staff bring an extra richness to the team. It's a multidisciplinary team, meaning that there's lots of different disciplines in there. Here in Brisbane, our team has got a music therapist, for example, certainly occupational therapy, which in other states, sometimes that can be termed a play therapist, social workers, psychologists, physiotherapists, lots of different disciplines are involved so that each child and family's unique needs can be looked at and the appropriate person pulled in to provide their expertise supporting what that child and family needs.
And just thinking about palliative care at the minute, through the action plan, it highlighted that we've got some work to do and there's some improvements that we can be working on. And it's fantastic that the action plan has been followed up with some investment. And more traditionally, cancer has had access to palliative care, but there is still more that can be done in that. But I just wanted to ask you about your vision for that broader community that, like my son, who did actually have access to palliative care until he was 21. And the way we used it was when he was very sick in his early years, we would do some respite when we felt up to that, because he went to very special kids and we knew that the staff there equipped to care for his acute seizures and the rescuing seizures and things like that. But then after that, we would just tap in and out when we felt like we needed support in that area. We would be able to go to events, or I could speak to a counsellor. I'm just wondering where you see we could go in that area where it's not as traditional to fall into that palliative care model, or for that to be part of the overall healthcare support for that child and family.
Yeah. I think you touch on a couple of really important points there. There is the specialist palliative care service traditionally based in a hospital. Yes, it might be important to tap into them at different times for specialist input, but community-based care is really important. You had access to very special kids. Much more work needs to be done in that space to have more community support available. At the end of the day, even if you are accessing the specialist hospital-based service, you're not spending your life in a hospital, you're spending your life back out in the community. I would really love to see us be able to develop the evidence to advocate for more investment in community-based services and support so that we're looking after children and families in the communities where they're living their lives. You know, those are some of the challenges that we've got ahead of us. With the pressures we have on the health system, it makes so much sense to have more investment in community-based services. Our role in that is developing the evidence to support that and really advocating for that need. In terms of who gets access, there's a lot of work that needs to be done in that space as well. I think a lot of education for community, for healthcare services themselves, for them to be aware of the need that's out there, the different sorts of conditions that children are experiencing, what it is that palliative care can offer and when it's appropriate to be referring to a service. Yeah, we need to break down some misconceptions about who is eligible when families are eligible.
I think the action plan, there was like 4 levels of when people might enter palliative care. So I think that's a helpful step forward to start recognising that there are different entry points to get different levels of support. It's been really interesting conversation, but we're coming to the end of our time. I would love to ask you, as someone that's been working this space and obviously very passionate about palliative care and paediatrics, what your hopes are for the CRE, but also in general, where you'd like to see this all go.
I think for me, success would look like when we go out there and ask families, are their needs met? They're able to say yes. I think too often we're still hearing families feel that they've been let down by the system, that they haven't had their needs met. In an ideal world, we would be able to develop a sustainable health system that is able to meet families' needs and provide the care where they want it, at the time they want it, in the way that they want it. That's my blue sky hope, that we are able to do that. Our CRE has funding for 5 years, and if we're successful, there is that opportunity to apply again and to keep advancing the field. The dream is to build capacity within the sector. By that, having more researchers, more clinicians, more health professionals with the training and expertise that they need so that they can provide that care to children and families.
No, it's a really exciting project, and to have that security of 5 years to work on these priorities. Like you said, I think 9 projects.
We've got a great team. We're certainly standing on the shoulders of many others who have come before and have paved the way. We've got an amazing team of expert clinicians and researchers who are there to help guide us, and our community and consumer partners who are there to keep us real. Bringing all of those things together will be our pathway to success.
No, thank you. And I appreciate your time today. I know Maurice is super busy in the back doing all the very important work that actually leads to change. I did just want to ask, if people wanted to learn more, is that something that's available now that they could see what the project looks like, or maybe email anyone?
Our website is not live yet, but we're hoping to have it live within the next month. In the meantime, people can email me directly, or we do have a CRE email address. Yeah, so we've got an email address where people could register to go onto our contacts list, and then as we get up and running, we'll be having newsletters and opportunities to connect in with the CRE through different events, and we can let people know when those are happening.
Thank you for your time. We will keep our communities up to date as the project progresses, all the activities that are happening as part of it. Again, really appreciate your time, and thank you for sharing your wisdom.
Thanks, Kris. Lovely to chat.